Alrighty, let's get started. Uh, Thank you all for joining us today. For about the next 28 minutes, we'll be discussing what you can do to make your building safer in today's COVID world. A little bit about me, John Tinsley. I'm based in Washington State up here in the Pacific Northwest, and I'm primarily focused on business development for healthcare accounts at Dalkia. So as a result, I'm very heavily involved in our COVID measure development efforts and all things associated there. So most of you likely don't know me, but for those of you who do, you know that my wife Katie is an emergency room nurse up here in Washington State. And if you'll remember, this was the initial epicenter of the COVID outbreak in the US back in the day. And so early in the outbreak, she's going to work and she's being exposed to numerous COVID patients every single day. And her hospital initially did a really great job, very strict protocols, PPE requirements, and everything to combat this. And then one day she came to work and her employer had completely changed their mask requirements. And what they were telling her to do is just wear a simple little surgical mask unless you're working with someone who is a confirmed COVID case, and confirmed being the key word here. So what's the problem with that? In the ER, you have no idea who has COVID. Folks are walking in off the street, patients are coming in for other things. You spend 2 hours with them looking at, a broken arm or something, do an x-ray, and guess what? Oh, yep, they had COVID that whole time. And this was happening every single day. And management really didn't take any action to address this and resolve this situation. And the message received there as an employee was, hey, I'm likely being exposed regularly on a daily basis, and I don't have the best tools to make sure I don't get sick. And so what does that do for Katie? She didn't feel safe at work. She didn't want to go to work, and as an employer, she felt like she had been totally betrayed and abandoned by the hospital group she works for, and essentially long-term lost a ton of respect for them and how they handled this situation. So let's bring this to today. Country is reopening. Employees are starting to return to work. Customers are starting to come back into our buildings, and I'd say everyone is a lot more aware, obviously, of the potential safety impact of going into any space or even just leaving the house alone. So what can we do with our buildings to make sure that people feel safe, that they feel motivated? How do we make our employees and our customers not feel like Katie did, going to work and feeling like she was going to get sick every single day? So to get there, I'm going to do a brief one-slide overview. Who are we? Why are we qualified to talk on this? Talk about current market state. What are people doing currently, or what should people be doing currently as well? Look at what's the health and safety impact on employee productivity, and then we're going to talk about what's the future. What can we do looking ahead to the end of this year to 2021? What happens beyond that? And how do we make this a recurring and ongoing safety situation? So brief overview of Dalkia. Many of you may know this. We're owned by EDF, leading electricity company in the world. And together with our sister companies, we offer a comprehensive solution for building energy efficiency. So that's everything from generation, either at the building or utility scale, power purchase, building efficiency upgrades, and a lot more. And why are we qualified to speak on this? We have a team of engineers, PEs, CEMs, HVAC, and refrigeration techs who their one focus is reducing energy usage for our customers. But as a result, they have a very intimate knowledge of building systems, and taken in combination with the studies that they've done on CDC, ASHRAE, all sorts of these national and state recommendations that are out there, we feel like we can combine those two knowledge bases and really form some critical recommendations here. So let's look at the market today. folks are attacking COVID safety in a number of different ways, and these strategies range in difficulty. But the overall challenge, I think, stays the same, and that's that compliance is a moving target. There's no one-time fix. There's new evidence coming out every single day. Hey, wear a mask. Hey, masks don't do anything. Hey, actually, they do something. Social distancing, 6 feet's the right distance. Well, in Europe, they say 1 meter, which is 3 feet. What's the right information? It's changing daily. I saw a news article our CEO forwarded me, an hour ago that was new information. And so things are changing, and employees are going to be well informed about this. It's number one in the news. So what can we do, and what are people doing? There's easy things, and you're seeing these everywhere. PPE, social distancing, people wearing masks, hand sanitizer, sneeze guards, all that. And are these truly effective? And to some extent, for sure, but they're very user dependent. You see the guy walking around wearing a mask, and his nose is hanging out, right? It's you're doing it wrong, and you're not protecting yourself and others there. And I know I forget to use hand sanitizer at the right times all the time. So those are some easy things. Where it gets a little harder is, how do we keep our air clean? How do we keep our surfaces clean? So the big challenge here is buildings are designed for full occupancy and then some. And what we're seeing now is people have to come to work 2 days a week or 3 days a week. It's partial occupancy. It's maybe shifted from normal schedules. How do you adjust your HVAC controls to account for that? And also, how do you sanitize your spaces in between, these less predictable work schedules? And then on the really hard side, how do we deploy this at scale across a portfolio? It's challenging to do it at one site. How do we do this, on a national portfolio? And then requirements change. How do you adjust that across a national portfolio? And finally, how do you take that information and take these really great things that you're doing and communicate them to your employees, your customers as well, so that they know they're entering a safe space, they know that you care, and that you've taken the time to figure this out. So talk a little bit about some examples of some hard things, but impactful things that you can do here. And these are really important, and we can definitely help. And if you're interested in details, I'm not going to read every word on this slide, but we can definitely delve into specifically how this might work. First of all, air. So a lot of recent studies are showing how more and more critical the air piece of keeping people safe is. And so there's a number of different ways that you can impact your air quality to counteract spread, and things like ventilate before and after occupancy, increase amount of outdoor air that's coming into the building, change out filters so that your filters are now doing their best to filter out the virus, things of that nature. So a lot that can be done there. How do we eliminate surfaces that normally would have been touched? Can we put in occupancy sensors on light switches so people aren't touching light switches and sharing that way? Automatic doors, things of that nature. And then finally, in the areas where we do need to touch surfaces, how do we sanitize those? Is it UVC? Is it electrostatic fogging? Some combination? What's the strategy there? These are some good solutions to do in the short term to take care of some of these risks. So other than the fact that keeping people healthy is the right thing to do, why would we do this? What's the cost of not doing this? And I would say that employee productivity is going to be our key metric here. And it's pretty simple. If employees feel safe at work, they're going to be more engaged and they're going to be more productive. The biggest change, though, is that now employees are informed and they expect buildings to be measurably safer. And I wouldn't be surprised if we look ahead a bit here, or even now, where employees are now expecting a safe work environment as it relates to COVID spread to be the same as any other benefit, or even more important, health insurance, 401k, safe work environment. These are critical things now. And so why is this important? How do we quantify it? So this is a JLL guideline on per square foot costs for business expenses. And essentially what it says is if you're trying to project your business expenses, on average, you will spend $3 per square foot on your utilities, $30 per square foot on rent, and $300 per square foot on your people. And so when we look back in the past, building systems primarily were impacting that $3 per square foot category with very few exceptions. Something's broken, it's 90 degrees in your building, yeah, people are going to notice that. Or hey, like we did a lighting upgrade, the building looks visibly different. People like that, they're happy about it. But what happens is, these are short-term $300 impacts. And it goes back to the $3 because we all know, you change a light fixture in your house, you notice how different it looks for a week or two, and then you kind of go on living your life and forget that you changed it. Now we're looking at this time where your building systems impact your people and their health, and they know it. And the benefit of keeping them safe is very substantial and very quantifiable. So how do we measure this? So we go, like, you went in, you made building systems changes that help keep your employees safe. You market it well. What happens? People stop calling in sick. Maybe your employee turnover goes down. Folks are working harder. They feel good about going to your building to collaborate in person on those critical tasks that require collaboration. And maybe that drives a 10% increase in productivity. Now, when we were looking back at the old energy world, a 10% increase in productivity nets you 30 cents a square foot in benefit. But now our building systems are impacting, like we said before, that $300 per square foot world. And so a 10% increase is worth $30 a square foot. This is a much different level of impact than we've seen in the past. So, we've talked about how to keep people safe short term. We talked about what's the impact of keeping them safe. Let's look into solving some of those hard and the extremely hard section of problems that we talked about early on. And so, this is things like adjusting for partial occupancy. How do we deploy measures at scale? How do we quantify the impacts? Let's look ahead and say, what's the best way? What's really the best way to do this? And so let's look at this. We're implementing, these clean air, clean surface solutions. We're doing it at scale. You've identified where you want to do it, what you want to do. And again, we will caveat, solutions are specific to building type, right? The solutions you're going to use in a grocery store, completely different from what you're going to use in a commercial office building. So important to recognize that there. And then from there, you want to measure that impact. You want to confirm in some way that, hey, yeah, the changes we made means our buildings are safe. And then finally, you really want to track those impacts over time and report on this performance as an ongoing reminder of, hey, employees, we're thinking about this on a daily basis. Like, we genuinely care about your health and safety. We need you in here. We need you working, but we want to make sure that we're doing so in the safest way possible and sending that right message there. And so in our mind, the key to doing this is what we would call digital buildings. And we think, looking ahead, this is going to continue to be more and more valuable. So what is a digital building? We've been hearing the term IoT forever, and you could say there's a lot of different meanings for digital building. What I'm going to focus on here is specifically as it relates to health and safety, quantifying, tracking, reporting on those, making changes. So, these are buildings that are going to sense their environment and the occupants and notify or react accordingly. And this could be things as detailed as like, hey, building does temperature checks on folks on the way in. or something even more big brother of like, hey, this building can track your employees' cell phones and we can do contact tracing based on their cell phone location throughout the space. So looking at the environment there, simpler things might be how often is the air being changed out in the building? What are the CO2 levels that measure occupancy? Figuring out how do we reduce our viral load in the case that somebody with COVID is in our building. And then other things, enable adjustment of settings remotely. So we talked about, let's say recommendations change, or let's say we want to just make some minor tweaks over a portfolio of buildings. A digital building really needs to have the ability to make those at scale across a portfolio and remotely. And then finally, we want to optimize for health, but then also we don't just want to blow up our energy bill. And there's definitely a break-even point here where it's like we are optimized for health and we can do a lot more that's going to make us use more energy, but let's make sure that we optimize for energy as well. And the last key piece I touch on here before we exit this slide is, in the past, I think we've looked at these things and said, dang, these are expensive, these are nice to haves. This isn't really something that is priced to roll out other than like a new construction building or extremely critical places like healthcare rapidly. But now I think what we've seen is there are quite a few systems out there that are truly priced for rapid adoption and rapid deployment. So we'll touch on a few of those. I'm going to go through some healthy building solutions that our customers are implementing right now as some examples. I think what I'd say as preface is, from what we've seen, the best solutions just do not come from a single manufacturer. Like the overall building portfolio of best solutions requires a systems integrator, and it requires multiple different manufacturers. And it's really not that complex overall, but I think if the thought is, well, we can find one person that does all of these things well, it's probably not the case there. So number one, talking about some of those measurable qualities, real-time indoor environmental quality measurements. So these are devices that are scattered throughout the building, wirelessly connected to the cloud potentially, and they're measuring and reporting on critical metrics. CO2 is obviously very important. You want to make sure you're changing out the air in your building. That's a major recommendation from a large number of extremely reputable sources there. VOCs, if that's of interest, things like sound levels. Again, these are really, it seems complicated, but these are easy to install and reasonably cheap to deploy in terms of monitoring your building. Switching over to sterilization and UV. So self-sterilizing surfaces are definitely a moving and up and coming solution here as well. And so what this is an example. This is a door handle, but it's essentially a UV activated nanoparticle. And when the UV hits this nanoparticle, it kills, COVID or flu or MRSA or whatever. And the benefit here is that it's continuous sterilization. So if someone is walking into a door, and let's say you have your typical, like, we sanitize everything at night. So you clean that door handle all night, it's clean in the morning. First person who comes in that day has COVID. Next person who comes in, touches the door handle, they're now at risk, right? So the benefit of continuous sterilization is this is now an automated process. You're not having to worry about, well, did we sterilize at the right time? What happened? Are we good? So that's there. Secondly, and we've seen this a lot, it's everywhere, UVC sterilization. So there's a number of different things folks are doing. Mobile services, like you see on the bottom picture there, permanent installations that run at certain times up above. And these are great solutions, but I would really caveat that these are not the cure-all that they are often being sold as. these need to be controlled. They need to be used wisely. And there's a lot more to it than like, let's just roll this thing in and hope it cleans the room. Need to do designs to figure out intensity, a lot of things. And you also don't want to just be running these into like a retail space with customers there. You know, this is not, you know, you don't want to just be doing it at random. You need to have a clear strategy there. Switching over to the HVAC focus side, something that we've seen get a lot of traction recently is a portfolio level VMS Lite. And so this sits in between a traditional building management system and like your just dumb or smart thermostats. It allows for cloud-based control, cloud-based reporting in buildings where typically you'd say, you know, I'm not going to spend $300,000 to install a full building management system in my 80 unit senior living community. You know, this fits right into that space. And the key here also is because it is cloud-based and you can remotely program your entire portfolio, you can set up programming for modes that are specific to COVID. So can, you know, get those outdoor air changes and all of those important things that are being recommended. Switching over to traditional building management systems. So again, most folks are probably pretty familiar with this, but this is a great way to adjust your schedules, adjust your operations to meet those federal and state guidelines. And what I'd emphasize here, you know, 40% of your building load on average is running through this system where you have it. I would emphasize really remote access is important, and especially having someone either on your staff or that you work with who knows all the ins and outs of programming and optimizing these systems. So that brings me to the last one we'll hit on here, and this is portfolio level control and especially analytics. So hooking into those existing building management systems, looking at your interval meter data, things of that nature, and doing a couple things. A, saying what things could you be doing to either optimize the space, make it run, you know, more efficiently, what, you know, pieces of equipment are getting ready to fail, which buildings are operating inefficiently. You know, example here, we work with a hotel chain and they had like 80% of their hotels were closed. And when they looked at their end of month usage data on their utility bills, they found out like one hotel had essentially been using more energy than it was before they shut it down. And so, you know, with utility bills, you get that information at the end. You know, with this type of control and analytics, you could understand that within, you know, an hour of those changes being made. So critical pieces there. So you're probably saying, John, great examples. How do I execute these? And so I'll talk through what we're doing with our customers and what, you know, I think is a good approach for executing and getting to our end goal. So number one, focus on what you can do today, and then also at the same time set yourself in motion for, you know, the later this year or 2021 projects. So for us, what we would do is we'd say, let's start with what we call, you know, a building safety assessment. So let's look at corporate policies, let's do assessments at sites and identify, you know, what are the short-term needs and, you know, what actionable recommendations do we have for how to improve safety and settings in the short term. And then in doing so, by already sending someone to site to look at these things, you can now lay the groundwork for generating what's our long-term strategic plan. And the end goal here is, you know, short term, let's provide a certification to your employees. Hey, your building's been assessed, it's safe, we're taking this seriously, we've had a third party look at this who knows what they're doing. And then long term, let's plan for the future. And so next step after this initial assessment is let's, like I said, let's lay out this roadmap of how to get from the today state to the ideal state of digital buildings in the future. So again, you start over on the left, and today let's assess, let's understand what that current state is. Let's evaluate what our strategies are for improving there. And again, we understand not everyone can upgrade every building to get here. Like, let's prioritize the highest risk buildings. Let's, understand what the most important things that we can do. And then if it makes sense, do that building assessment for those buildings. Moving ahead to later this year or still now, let's correct those issues that we identified in the short term, and then let's budget for what projects are going to come up that take us to the next level. So that leads us to 2021, depending on, maybe late 2020, depending on budget cycles. But now we can implement those HVAC controls upgrades, those no-touch surfaces, things of that nature. And really, let's get that building to digital. And then after that, hey, you've got the tools to manage and report. You can have those key safety metrics that you communicate to your employees, and you can optimize your portfolio to run exactly as it should. And in our hope, we get back to safe times and vaccine and all that. And you can now leverage these tools to make your building run as efficiently, energy-wise, as it possibly can. So just in closing, after you leave here today, I'd like, take a second, think about how to engage your employees. How do we keep them safe and productive? What are the key metrics they might care about to feel safe? And how do we stop them from feeling like my wife Katie did with her loose fitting cloth mask just in a hospital room full of COVID? So thank you all so much for joining us.